Well, I show 12:02, so we're going to go ahead and get started. I'm Allie Orwig with the Indiana Rural Health Association. We really appreciate everybody joining us today. Just a couple quick housekeeping items before we get started. The first is that if you have any questions during today's presentation, feel free to use the chat or Q&A function to submit those. You do that by hovering your mouse either at the bottom or top of the screen, depending on which view mode you're in. I will try to act as moderator and keep my eye on both of those during the presentation, and then we'll definitely have time for questions at the end. Also, we are recording today's session, so if you're not able to join us for the whole time, or if you want to share this presentation with a coworker, it will be available by the end of the week on our YouTube channel. And you can get to that very easily by just Googling Indiana Rural Health, YouTube, anything like that. It'll get you there pretty quickly. We also have a link on our website under events. There is an archived webinar tab. So you can always access any of our old lunch and learns that way. And without further ado, I'll go ahead and turn it over to Elizabeth Burrows and Lacey Foy to start the presentation.
Hello, I'm Elizabeth Burrows, and I have the honor of working with most of the rural health clinics, the FQHCs, and the critical access hospitals in Indiana. Oftentimes, you guys are asking me questions quite regularly about HPSA scores, how to improve my HPSA score, do I maintain my HPSA score, how can I get a HPSA score, how can I get an MUA score? And so there's lots of questions. And even today, what happens if I move my rural health clinic? What happens if I want to get loan repayment for one of my doctors and he works here part-time and here the other time? So our goal right now is to get as many sites signed up for National Health Service Corps and to better utilize their HPSA scores. And so I think that's what Lacey's going to focus on, but it is with great pleasure that I introduce you to Lacey Foy. Lacy is the person at the State Department of Health who is responsible for your scores, your HPSA, your MUA, and any other designations. And she also oversees the National Health Service Corps program for Indiana and the state loan repayment program. So she's really important to the recruitment and retention efforts here in our state. So I'm going to turn it over to Lacy, who's going to be sharing some slides about how to use your designations and learn more about them. So thank you for joining.
Thank you, Elizabeth. My name is Lacey Foy, and I am the Office of Primary Care Manager in my normal role. For the last year, I've been working COVID response. So my primary right now is vaccine distribution, but we have a really exciting update coming for HPSA designations. The National HPSA update was supposed to happen last year, but it has been pushed to this year. Last year when I did this presentation, I did slides and I didn't really feel like everyone was able to see the exact thing that I do when I do a designation and what factors actually go into the score and how we actually look at those data when we're doing a designation. So I decided I'm going to share my screen and we will walk through all the parts of what I do when I analyze a HPSA designation and what factors actually go into your scores. So I am going to share my screen. So the most important thing when we look at HPSA scores is provider management. And provider management is very important because we need to know exactly what providers are serving the area that we are looking at. So in this case, I'm looking at Adams County. And if we're doing primary care, I would look at just the primary care discipline. And when we talk about providers, it's easy to say that a provider is serving in an area, but we really want to look at what that provider is actually doing there. We have lots of different specialties from internal medicine to pediatrics, but the ones that we actually really focus on is general care. So that's where a patient could call and make an appointment for a sore throat, muscle aches and pains, not feeling well, annual physicals, vaccines, things like that. So if any of the specialties are more specialized, like if you have an internal medicine, critical care provider, or internal medicine nephrology, those providers are not actually going to count in the scores for the area because they're more specialized. And while they may see general patients in their practice, we're really looking for people that are giving whole care to the person, that can call anytime and are able to get an appointment. So I'm just going to click on the first person so I can kind of show you what I do when I'm uploading providers into the system. Luckily, we don't have to go one by one like we used to a couple years ago. We have a really awesome system now where I can do batch uploads of providers. So it makes things go a lot quicker, but this will at least give you an idea of what I look at when I'm doing a designation. So all of the providers that are in the designation management system have to have an MPI number. If they don't have an MPI number and maybe they bill in another method, then they won't be included in the designation. So we look at first name, last name, phone number, just make sure those are correct in case I need to call them and make sure that they're still practicing at that location. So I really try to make sure that their phone number or practice clinic phone number is correct. It's not super important, but I do sometimes call providers if there's a designation question. The most important is this address right here. A lot of providers will give their home address when they sign up for the MPI, and we cannot use that because they're not actually providing care there. So we really want to make sure that the address that is in this system is where they're actually providing face-to-face patient care. So down here, if you look at locations, I can see that there's 2 locations in here and both of them are ineligible. So reasons for ineligibility include they have moved recently. That location is like an urgent care or somewhere that doesn't have primary care services. It could be a hospital address. We've had addresses that have been abandoned buildings or weird places. So there's a lot of things that could make this ineligible. Government locations like VA outpatient clinics or outpatient VA hospitals, they are also going to be ineligible. So any governmental address we mark as ineligible. We also want to make sure that their discipline of specialty is here. Any specialty, like I said before, is if it's not internal medicine, general medicine, family practice, pediatrics.
This morning, a juror who deliberated in the Derek Chauvin murder.
And OB-GYN. If those are not listed here, then they will stay as ineligible. We also have their direct tour hours. Tour hours mean direct face-to-face patient care. This is where the provider is sitting right in front of the client or the patient, sorry. We do not count telehealth hours or any hours that are spent with medical students or hours that maybe a provider goes and checks on patients in the hospital, doing rounds, anything like that. These hours are only for direct face-to-face patient care. So if I find that this provider has moved locations and I want to add the new location in, I would just click this button, add in the new location, and then I would actually put the amount of hours that they're working as well. So when we look at hours, we look at FTE, and we want to make sure that that's as correct as we can possibly get it to be. If the hours are off even just a little bit, it can be like a make or break between getting a designation, an application designated, or getting a score up 1 point, anything like that. So we want to make sure that those are accurate as possible. I don't focus too much on taxonomies as long as it says allopathic or osteopathic physician. I usually just make sure that they're physicians and that's it, and that their taxonomy state is Indiana. Anyone that's not practicing in the state of Indiana is not eligible. I can see different changes and where they've moved. It looks like this person has moved into Indiana, but we do not have her as an eligible provider for some reason. And then I can put comments down here as well. So we also look at the patient population that is Medicaid and sliding fee scale. So those calculations will go into calculating a score for that provider, and it goes into their FTE as well. So we use those when we're doing low income designations, so we can see what providers are actually serving Medicaid and low income patients. And anyone that doesn't accept Medicaid or have a sliding fee scale or has reported 0% of their patient practice is Medicaid, they actually are excluded from that count in a low income population designation. So providers are super, super important. They are the basis of everything HPSA. So it's extremely important that I get this part right. So if at any time you want to know which providers are in your county or which providers are being utilized in your designation application score, please reach out to me. I can't send this information out to you, but we can do a screen share or phone call. We can go through the providers. You can tell me who's working for you, and we can update it that way. Or you can just send me an email. That's totally fine too. But the providers are such an important part that I really want to make sure that I have these right. So currently I use survey data from the IPLA, and I go through all of that data and have special checks where I look at all of the things that I've showed you before I even upload anything into this system. All right, now that we know about providers, we are going to go on to how the designation is actually done. So we're just going to do a test designation. I don't have any blank ones, so we'll just make a new one. Does anyone have any questions up until this point?
We haven't had any come in yet, but again, I'll encourage everybody to use the chat or Q&A.
And just a reminder too, that a lot of people, when they actually see the lists are not correct. It's not Lacey's fault. It's just the system isn't correct and people have changed, moved, switched hours, switched locations and everything, as we know with life. So keep in mind, it's really good to stay on top of this and make sure that your list is up to date. If people are in administrative role and, you know, only seeing patients 20 hours a week, that's relevant for her too.
Yeah, the providers are really the most important part of this, and how many hours they're actually providing care. You know, we have a lot of providers around the state that have medical students or nurse practitioners that are studying under that position, and none of those hours count. So it's really important that, you know, we have accurate provider counts so that we can, you know, continue to maintain our scores for recruitment and retention. So I try to stress that as much as possible. So I'm happy to share providers and, you know, who's working in your area because it is so important. Okay, so the first thing I'm going to show you is something that is not super important, but something that I just cannot get past. So if I choose an area, and let's say we're going to do Marion County, this is a primary care geographic high needs application. And when I do these type of applications, I always start with geographic high needs, and then I do a geographic designation and then population designations. And the reason I do that is because I want to see which designations qualify, which designations do not qualify, and if there's anything that I can possibly do to raise scores or get the type of designation that would be best for the area. So if I get this error right here, it means that I cannot go any farther. There's not a lot that I can do. I can edit providers, but if I've already edited the providers and I know that the information is correct, there's not a whole lot that I can do to get past this. So I can always see what is wrong, why this rational service area or the RSA did not pass. So the population at the federal poverty level, it has to be higher than the threshold of 20%. And that's because this is a geographic high needs population. This is looking at the population within the boundaries of the county, and to be considered high needs, there has to be a high rate of poverty in the area. HRSA set that at 20%. So even if it's 19.99999, it won't qualify. It has to be 20.0 or above. They also look at fertility rates. It must be, this one's really confusing because they say there's the threshold is 100. The calculation is really funny. So a lot of times if we have a fertility rate error, since we use national data, there really isn't anything we can do about that. We just have to go on to a different designation type. This type of designation also looks at the infant deaths per 1,000 live births. One thing that I am pushing for is that the threshold needs to be lessened because right now it's at 20%. And if we had a 20% infant mortality, that would be really horrific. And even 7.9566 is not great whatsoever. So I'm hoping that with the maternal care designations that will be coming out, hopefully this year, we can start to lower that high needs threshold, because I don't know anywhere where it's that high. So it really is a barrier to getting these designations in place. This one also has two insufficient capacity requirements that are not met. So insufficient capacity are any of these reasons up above. If insufficient capacity is the only thing that is a barrier to this designation, I can actually go in and upload things like ER visits for primary care. So if a if an emergency room has half their patient population that are just coming in for primary care services, I can use that data and show that there's insufficient primary care capacity in that area. A lot of times we see that more in smaller designated areas or really highly populated areas. Doesn't seem like there's too much of a middle ground with that one, but it is something that we can do. We can also show a couple other things with that in that people are using urgent care centers or different places other than a primary care office for their primary care services. So anytime I do a designation also, I make sure that the designation in place is going to be replaced by a designation that's better or the same. That is a little bit difficult sometimes, especially in higher populated areas that are close to rural areas. So we want to make sure that our rural areas are getting the services that they need. But if a urban area has a ton of providers and it borders a rural area, that rural area will not be able to get a designation because sufficient capacity is shown in that neighboring urban area. So I really try hard to make sure that any designation that I do is going to be replaced by the same or an even better designation. The next thing that I look at is population counts. The population count for Marion County is very high. And so we can really only look at populations under 250,000. If we go over that, we usually try to break it up some, which is actually better for rural areas that are close to large urban areas. So it makes it a little bit better for them. So since that one didn't qualify, we will go back and we will look at another area. So I am going to choose Vermilion County. Okay, so this little yellow warning, I can still continue because it basically only means that we are looking at an area that already has a current designation. So we look at the population center, and you would think that the population center is not a super important part of a designation, but it's actually really important because it calculates the travel radius. So I can move this up and down to pretty much wherever I want to move it. For population designations, this has to go in the county seat. I don't have any control over that. That's just what HRSA requires. So normally when I do a geographic and geographic needs, I just leave it where it sits. It is supposed to be in the most populous census tract, but it 90% of the time doesn't happen that way, which is okay. So what we're doing now is we're calculating the travel polygon. And what this is this is going to show where people in this designated area can access primary care services. So this actually looks at Esri map data and calculates 30 minutes in every direction from this flag. And it calculates the contiguous area where the population would be able to drive within 30 minutes to get care. And as we all know, in rural areas, sometimes it takes 30 minutes just to get to the grocery store, or sometimes providers are not within that 30 minutes. So most of the time, these contiguous areas will pass analysis pretty easily unless you're next to an urban area. So we have to do the contiguous area analysis for a couple of reasons. We want to look at if there is actually enough capacity to allow for the patients in the rational service area to receive their primary care services anywhere close to where they're living. So that's what we do in this area. So we just choose the area that's close, that the black line touches. And I'm not going to do all of these because it takes a long time. But I would like to show you what I can see and things that I can kind of bypass in this area if I need to. So when I talk about bypassing, I can actually enter in adjusted populations. And this is actually really helpful when we're doing urban area that borders a rural area. I'm definitely going to have to do it in Boone County this year because we're really looking to doing as many high score rural designations as possible. And Boone County borders Indianapolis, and Zionsville's in this little corner. So it's really difficult to get a designation in these donut counties here, where we have both urban and rural populations. So when the contiguous area is valid, that's great, because it means that, I guess I shouldn't say great, because it does mean that the capacity for receiving primary care services does not meet the requirement in this area. So they are essentially in a shortage of providers as well. But it's good for this designation because it means that we can go on to the next step. So if this area didn't pass, I could actually come over here and look at the data for that area and see where I could potentially either upload data to show that it would meet criteria or things like that, because sometimes we can do that where we can upload data that shows like, oh, well, this is actually, you know, recently their poverty level has gone a lot higher than what's reported in the system. Oh, let me skip it. So normally I'm not going to go through all of them because, like I said, it takes a really long time. But when we do this, we make sure that all the areas pass. To be able to pass, it has to either be a designated area or have an overutilization of providers. After that, I go on to this step 3, where I find the nearest source of care. This is just one provider, excuse me. And I will basically look for someone that is close enough to provide those services to the patients in the rational service area. And providers that are eligible are those that accept Medicaid, have a sliding fee scale, and work in an area that is not overutilized. So a lot of places in Indiana do not meet this criteria. So we really don't have a difficult time finding nearest sources of care that are actually usable. So a lot of times this part of the designation is going to give us a lot of points. After that, I save it and submit it. And the way that the designations work is that it is, once I submit it, it's 30 days for a comment period. So anyone in that county or community can comment on the designation, and they can say, oh, we really don't think this is a good idea. We would like, you know, to get NHSC or a J1 or anything like that. So there's that 30-day comment period. After that, my project officer will look over the designation, make sure that I have submitted everything that I need to. Things that I submit are basically just screenshots of maps showing that the nearest source of care is outside of this black travel polygon. If the nearest source of care is outside that black travel polygon, then the designation application actually gets 5 points, which is fantastic. That's like my favorite part of this whole thing. It's when we get 5 points. So he will look over everything, make sure everything looks good. And then what will happen after that is he will send it to secondary review. And secondary review looks at everything, make sure everything's good, and then it goes on to the designation branch chief. And Dr. Janelle looks at it, makes sure everything looks good, and then gives her stamp of approval. That process takes about 60 days. So it's about 90 days in total from start to finish. So in this whole process, the score that each of these designations get can vary based on the type of application. So when we're doing an application like this, the first part, when we create the RSA and we are looking at different areas, we can actually come over here to this content part and look at all of the things that are going into the score. And so all of this data actually goes into the score during the RSA part. So you can get about 10 points in that first RSA when we're looking at the area that's to be designated. And then when we're looking at the contiguous areas, there's not really a lot of things that I can do to increase points for that. It's basically, it either qualifies or it doesn't. And then, like I said, the NSC can give you up to 5 points. So this is just for a regular designation. This is going to be for populations or like county boundary ones. We can also do Autohipsis, and with the Autohipsis, anyone can do these on their own if they're an Autohipsis designated site. So if you have this on your portal, what you can do is you can go into here and you can do the designation all by yourself. I am totally happy to do these. I actually really like doing Autohipsis designations, but we can do it together or you can do it yourself. You can do a primary care designation update. You can do just a dental health. You can do a mental health one, or you can do all three. And a lot of times you can do all three and do a system update. So basically what you would do is come in here and you would just enter in the fluoridated alcohol misuse and substance misuse information. Then you would click Save Project Progress. Do the site and nearest sources of care. These are usually preloaded for you, and they're really easy. You don't have to do anything with these. You can upload any supporting documents, and you just upload those right here. And then here over in Rescore, you would basically just, there's a button over here that you would press to submit it. And that's it. It's super easy. The Autohipsis designations usually get a lot higher scores because for FQHCs, we are looking at a combination of zip codes, and they're called ZICTAs, and that creates your service area. So it's a lot easier to do the FQHC Autohipsis, and I really like doing those. They're my favorite, actually. The rural health clinics are a little bit different because we actually look at census tracts with those. And the way that those are done is a little bit more difficult, but luckily for us, all of the rural health clinic auto designated areas, if you want to do that, they are, I'm so sorry. They are a little bit more difficult because of those census tracts. And it takes a bigger area, I guess is the best way to describe it. It takes a bigger area into account, so you've got more providers. But same thing, we would just do that right here in this area. And I can upload all your data, or you can, super simple parts. Same thing with the Hipsis and the Autohipsis. They will be updated this year by September. My goal is to have them done by July. So the next thing I wanted to show you is, oh, I had it pulled up, but that's in the way. Is the Hipster Find website. So anytime that you need scores, I'm happy to get them for you, and I can also do like an official letter from the primary care office with your scores and HPSA IDs for any grants or anything like that that you're working on. I can also provide these for changes in rural health clinic status or establishing a new rural health clinic. I also do this in part with acute care, since they do the rural health clinic program. So just reach out to me in an email and I can get those for you. But the Hipster Find website is really great to know about. Because it shows all of the scores for every single site, every single county, every single designation in the state. And these scores and the HPSA FTEs are really important for programs like NHSC. And this year, our DRO state lead, Salida, we are working on getting as many NHSC certified sites in rural areas as we possibly can. So we have been coming in here every single day looking at scores. I feel like I should probably have this memorized by now because we've been looking at it so much. So basically you can search in here, you can look at low scored areas in non-rural and rural areas. So I hope I think that last year I did a whole slide just on scoring, but when we look at scores, I think about it as everyone on a ladder, and depending on their score is how many rungs up on their ladder they are. So those with lower scores like this, they are going to be lower on the ladder. And then when HRSA dumps the big bucket of money off the roof, those higher up get more money, those lower down get less money. That's essentially how NHSC loan repayment works. It's not the best analogy in the world, but it works. So these counties with lower scores down here, we're still trying to get them NHSC certified, because in the event that their scores go up during this national update, then we can get them scholars and recipients in that area. So even if the score is a 3 or a 5, we still want to get certified sites in that area, because those scores could change anytime. You can ask for a rescore at any time. So that's something that we're really trying to push this year, is getting those sites certified. So we can also look at rural status. We have a lot of non-rural areas that are designated. So that's another reason why I'm trying to do every single rural area with a designation with a high score. So a lot of times we'll see low income designations, even in rural areas with low scores. And it's going to be really important for me to try to get these up. You can see there's a 0.29 shortage. What that means is that is how many FTE it will take to remove that designation in the area. So while we know that they do have a small FTE shortage, when I update the provider count, this could change drastically and push that score up. So if you need scores, this is the best place to get them. As far as NHSC goes, I know that it's a very confusing program, and there's a lot of things in the program that you may need help with. So this year I am offering technical assistance again. And what we are going to start doing, and I've started doing this with some of my other sites, is just starting back at the basics, making sure that the area is in a designated county or has a facility designation. Second thing is really looking at that Medicaid and Medicare sliding fee scale service message, making sure that those things are posted where patients can see them easily, because that's a part where that really trips a lot of sites up. And so I'm just going to go to the NHSC website really quick. So a lot of times we will see photos of just the sign come in for that portion, and we really need to see where that sign is located. It doesn't have to be super up close and a beautiful picture. Just a picture with an arrow, like here's my signage. That works perfectly. There is a webinar on Wednesday, May 5th that will kind of go over all of this stuff too. But my goal is to really break this down so it's easy, and I would never say fun about this because it takes a really long time. But the things that I have learned, I hope will be really helpful. Those of you that are wanting to do a behavioral health site along with your primary care site, the behavioral health services checklist, this right here, was really difficult for some sites last year because you have to turn in verification of absolutely everything. all of the services that you provide. So if you do screenings and assessments, you would have to turn in a copy of the screening and assessment. If you do treatment plans, that has to be submitted with your application, any care coordination. So all of this has to be filled out, and you have to include any affiliates that you have. And so this means, let's say you have an affiliation agreement with a hospital where you send patients for inpatient treatment. That has to be entered here, and we would also need a copy of that agreement. So this one is a big one. This is a bear of the application portion, and it is probably the second thing that gets denied the most often. The first is the non-discrimination statement. Our state lead puts your non-discrimination statement on a screen next to the one in the NHSC handbook and goes word for word and makes sure it matches perfectly. So that one is one that is the most, that's the reason why most applications get denied, is because their non-discrimination statement doesn't match. So I'm here for all of your NHSC site needs. We are in an application period, and it goes until May 25th. You must turn your application in by 11:59. And if it is 1 minute after that, they will deny it. So make sure that you get it in there. What I've been doing with some of my other sites is meeting weekly or bi-weekly and having all of the documents that are needed for NHSC review. So I will go over them. I will mark anything that needs to be changed, like dates or wording or anything like that. I could probably do a whole webinar on things to watch out for with NHSC site applications, but I will go through all of that with you, and we will do it together, and I will basically point out things from the site reference guide that you will need to know. If you are planning on becoming an NHSC site or want to apply, this site reference guide has every single thing in it that you will need. Make sure that you download it and read it. That's the best advice I can give for new sites or even those that want to recertify, because every single year something changes. There's always little things that get tweaked or added or something like that. So that's a really important thing to do, is read it. Your HPSA designation is going to be what allows you to get an NHSC site certification, and it's also going to allow you to recruit those professionals to your area that are NHSC scholars or loan repayment recipients. Last year, the score that it went down to was 18. Every site recipient or every recipient of NHSC or scholar has a score that they have to, has a designation score that they have to work in. So let's say you have a recipient that has a score of 18. They have to work at a site that has a score of 18 that's NHSC certified. And if it's a 17 or a 16, they won't be able to work there. So that's why scores are really important for recruitment and retention, especially with NHSC. For J1 visa waivers, there isn't really a score that needs to be, there's no like cutoff score or anything, but they do have to be practicing in a HPSA designated area. So if you have a recipient, a J1 visa waiver recipient that you would like to recruit to your area, they you must be in a HPSA designated area. I did kind of skip over MUAs and MUPs just because we have not updated those in so long. So if you currently have one, those will not be included in this update. I'm not sure when those will be updated, but those are pretty secure right now. Those are not going to be changing anytime soon that I know of. And those designations have a little bit different scoring tools. They actually look at all age ranges, including those over the age of 65. And so any MUA or MUAP that we do has to have a score of 62.0 or higher. We can also do a governor's medically underserved population designation. And that one actually has to be approved by the governor. And so that one is pretty labor intensive. So if anyone is interested in doing that in an area that doesn't qualify, and you would like to have that exception done, please reach out to me. I have done a couple, so I hopefully will be able to assist you in getting those done. Other than that, I guess the only other incentive left to talk about is the CMS 10% physician bonus payment program. And that is only eligible for those sites that are located in the geographic and geographic high needs areas. And those designations allow for 10% back quarterly on all Medicare claims that CMS accepts. So that's a pretty big incentive that a lot of clinics like to have. So I'm happy to walk you through that one as well. And then the rural health program also needs to, the site needs to be in a HPSA designated area. And that's all I have right now. Does anyone have any questions?
We have not had any come in yet. This is a great time for anybody to submit any final questions, or if you'd like to raise your hand, we can allow you to ask a question verbally. I will direct everybody that we have put a survey link in the chat function. It's very important for us to collect data to improve these lunch and learns all the time. Want to make sure we're meeting the needs of our attendees. Literally takes about a minute to fill out, so we greatly appreciate you taking time to fill that out. And we'll go ahead and leave the line open for just a minute here to see if any questions come in, but really just want to thank you for doing this presentation today, Lacy. It was extremely informative, and I think everybody should have a much better understanding of the process now.
Thank you. And I put my contact in the chat too. I know it's a lot of information, so I'm happy to answer any questions that you think of later too.
Still not seeing any questions come in, so I think we'll go ahead and end the session. Again, thank you to everybody, especially Lacy and Elizabeth today, for bringing us this great presentation.